H2FpEF score is a simple scoring system using clinical characteristics and echocardiography for differentiation of heart failure with preserved ejection fraction from non-cardiac causes of dyspnea. H2FpEF score was developed by Reddy and colleagues using a derivation cohort of 414 patients comprising of 267 cases with HFpEF and 147 controls. The test cohort included 100 consecutive patients, of which 61 had HFpEF. It was a retrospective study in consecutive patients with unexplained dyspnea referred for invasive hemodynamic exercise testing. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. The variables used and their weighted scores were as follows. H2, heavy, body mass index more than 30 kilograms per meter squared, 2 points. Hypertensive, 2 or more antihypertensive medications, 1 point. F, atrial fibrillation, paroxysmal or persistent, 3 points. P, pulmonary hypertension, pulmonary artery systolic pressure estimated by Doppler echocardiography more than 35 millimeters of mercury, 1 point. E, elder, age more than 60 years, 1 point. F, filling pressure, Doppler echocardiographic E by E prime more than 9, 1 point. Total score possible would range from 0 to 9 points. The odds of HFpEF doubled for each 1 unit increase in H2FpEF score. The authors suggested that low H2FpEF scores of 0 or 1 can be used to effectively rule out the disease, while scores of 6 to 9 can be used to make a diagnosis of HFpEF with good confidence. Intermediate scores of 2 to 5 would call for additional testing. Suzuki and colleagues did an external validation of the H2FpEF score in a prospective Japanese cohort of 356 patients with mean age of 73.2 years. Mean H2FpEF score of the entire cohort was 3.1. 15 patients developed heart failure related events during follow-up, of which 2 were deaths and 13 were hospitalization for heart failure decompensation. H2FpEF score was significantly associated with the future occurrence of heart failure related events. A score of 7 points out of 9 had a sensitivity of 47% and specificity of 96%. The study was in stable Japanese outpatients with at least one cardiovascular risk factor. Another study by Tao and colleagues evaluated 151 patients with HFpEF in a prospective cohort to check the association between H2FpEF score and 1-year readmission for heart failure. They found that H2FpEF score had excellent predictive value for 1-year rehospitalization in HFpEF patients. They further observed that obesity, age more than 70 years, treatment with 2 or more antihypertensives, echocardiographic E by E prime ratio more than 9, and pulmonary artery pressure more than 35 millimeters of mercury were independent predictors of 1-year readmission. Here are the relevant journal references on H2FpEF score. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.